welcome to Thinking Out Loud. I'm Gloria Politis of LTC, your host, and I have two guests with me today from the DYouville Life and Wellness Community, Naomi Prendergast, who is the CEO, and Mike Ferrick, who is an administrator and the director of post-acute care.
Correct.
So welcome, thank you for joining us.
Glad to be here.
Thanks for having us.
Yes. Well, like some of the older members of the audience, I recall when it first started as DYouville Manor, and now it's the Wellness.
Yeah, DYouville Life and Wellness Community.
Exactly,
That's right.
exactly. So can you briefly describe what has occurred to make it the Life and Wellness Community?
Sure, we absolutely have grown over the years. We actually started in 1960 on our same campus. We are sponsored by the Sisters of Charity of Ottawa, so we are a Catholic healthcare organization. It's very mission-driven. And honestly, it's that mission that keeps us always looking to see what are the needs of the community and how can we help. So when DYouville Manor opened in 1960, which by the way, if you recall, was before Medicare and before Medicaid, but the sisters knew that caring for older adults in the Lowell area was something that would be very important for the community. And so we opened a nursing home at that time. And then if you fast forward from 1960 to 1998, we built a brand new building on land adjacent to the old DYouville Manor. We renamed the nursing home DYouville Senior Care. And we actually expanded it a bit too, to 208 beds. We also, by then, had also been operating an adult day health program. So we were very happily running the nursing home and the adult day until we were listening to the community about the needs of housing, affordable low-income housing that would be safe for elders in the Lowell area. And so working with our board of directors and HUD, we were able to open 63 apartments that we call Briere Gardens. We actually opened it in two phases, phase one in 2006, phase two in 2009. But together, those apartments operate as a 63 apartment community for low-income seniors. Totally independent, they have their own kitchens, everything is great. But we also were hearing that there was more of a need for short-stay rehab in the community as well. And so in 2012, we opened the DYouville Center for Advanced Therapy, which is all short-stay. So we have that as well. In 2015, we opened the Saab Residence, which is 60 apartments of assisted living, including 30 apartments for people of low and moderate income, and that includes 15 apartments for memory care. And in fact, we also have two tenants on our campus. We have Encompass Health, which until recently was called Health South New England Rehab Hospital, that has 22 inpatient acute rehab beds, and also Fallon Health has Summit Eldercare, which is their PACE program on our campus too. So we're a very busy place, Gloria.
I think so. My goodness. So things have changed over the years, and healthcare especially, I think, has changed in many ways. So that and eldercare in particular. So what are those changes and how have you dealt with them?
The environment's always changing for us. Healthcare is fast-paced, and it seems like every day there's a new expectation or something new that you need to be looking for and striving towards. So in elder care, one of the things that we've noticed over the past 3 or 4 years, it mainly relates to our short stay program. People that are going into the hospital and having an exacerbation of some type of illness or maybe an orthopedic procedure, and before they go home they need to go somewhere for a week or so to get built back up and strong enough so they can get back to where they live and start doing the things that they used to do before they had whatever situation that they're currently having. So the biggest change there has been for a long time in our industry and certainly at our buildings. You know, we focused kind of on folks that were getting orthopedic and less complex procedures, who were very, very straightforward, needed some nursing care, but a focus also on their rehabilitation to get strong and go home. Across the board, you know, the role of the nurse has just expanded so much in our sector of the industry, and we can take care of folks now that are a lot sicker than they once were. So, you know, we do IV antibiotics now. There's wound care and wound vacs that we're very, very versed in. People that have a lot of diseases going on at once, whether it be COPD or congestive heart failure, diabetes. We can take care of those people at a level that before they may have had to stay in the hospital a little bit longer. So we've really kind of broadened our horizons and become very, very good at taking care of skilled patients with complex medical issues.
Right.
Yeah.
And some of those aren't necessarily elderly, those who go into rehab.
No,
Right,
we get elderly, we get younger folks, but you see a variety of people.
Yeah.
The vast majority are older
Right.
adults,
Right.
absolutely, because there are also home care options.
Right.
But for somebody who is 85, who might have had surgery, that person probably also has some other medical conditions that would mean that they really need a lot more care before going back home, and that's where we come into play.
Right, right. I think it just surprised me when my great aunt was there that there were young people in
Right.
rehab. So just-
Yeah.
Absolutely.
Yeah. So you need a lot of people
Yep.
to take care of all these people. So I know there have been healthcare staffing issues, and we've seen that in the news in recent months as well. So what kind of challenges have you had to keep enough people there to take care of the people you need to take care of?
Yeah. Staffing really is probably the foremost issue facing our industry right now on a day-to-day basis. We've seen it in the news. We're not the only industry that's looking for people to work. Unemployment is very, very low right now in Massachusetts. They're starting to call it a full employment state. People have jobs, so it's tough to find people that are looking for work, especially when we kind of have a specialized workforce where you need licensures, you need to have experience, you need to have skill level. So it's an absolute challenge to find people. We need to get more and more innovative to figure out how to encourage people to come into our industry and get the licensures needed to work with us.
And another challenge that our industry has that it's not shared by a lot of other types of organizations or professions is that most of our reimbursement is public reimbursement. We get paid through Medicare, through Medicaid, through commercial insurers. There's a small amount of private pay, but mostly it's insurance companies, and they set the reimbursement rate. So therefore, as wages go up, which of course they have, which is a wonderful thing, and again, we're very much a mission-focused organization. We want to pay our staff as much as we possibly can, but our revenue pretty much is capped. And so as wages go up, we have much more difficulty paying our staff what we would want to be paying. Unlike other industries, if we were to go to a restaurant, let's say, and as the minimum wage goes up, the menu prices are going to increase. We cannot increase our prices and then pass that amount on to the consumer. And so we get squeezed in our industry much more than what other types of organizations or professions might. And so that's really a challenge. And as Mike mentioned also, there are a lot of people who would rather not work as hard as one has to work in healthcare. And so if somebody is going to be looking at making $13, $14, $15, $16 an hour, one has to look at, should I work at a big box store, or should I provide much needed personal care and attention to an elder?
Makes sense. Having faced that decision of placing people into care, what questions should people ask for themselves or somebody who is responsible for their care when they're looking for a nursing home or whatever care that they would need?
I think the first question actually should be about the ownership. Is it a for-profit, a not-for-profit? What's the history? What is the longevity of the people in leadership? What is the turnover of staff at all levels? But starting from right at the top, I think that that's very important because it's hard to consistently deliver on quality care if there's turnover in the leadership. And then, of course, going for a tour, just popping in at any time. But there are a lot of questions that people ask.
Yeah, we encourage people to come out and see us and come out and see a lot of places. Start learning about elder care and senior care and then what's out there for you. Our industry, unfortunately, a lot of the times is just so crisis driven. People are put at decisions they have to make and they have to make them kind of quickly, and it'd be a lot easier if it didn't have to make that choice in 2 or 3 days. You've kind of already been thinking about this for a year or two. So there's no bad questions, because people, and we understand that when people come in and tour, we want them to ask anything and everything. And we know that a lot of this is new to folks, but don't be afraid to start too early. It's much better to start too early than way too late.
This is true. Yeah. And it's interesting that you say that, because one of the first things I started looking for was the want ads in the paper, and if I saw a nursing home that had a lot of turnover, I'm not even going to look at
Well,
at that
part
one.
of that, though, is the industry.
Right.
And
right.
there is going to be a certain amount of
Right,
turnover that's
right.
inherent no matter
Right.
What organization you're looking
Right,
at.
right.
But yes, absolutely, it's good to take a look
Right.
at all levels. And there are some rating organizations. Medicare.gov has a website that also will give criteria on nursing homes.
Right, right. And as you say, there's bound to be turnover, but as you say, you start looking a year ahead. And of course, now want ads aren't as much of a clue, because you have to look on the web. That's where people advertise. But that is one of my concerns. And one of the other ones was if they let you come visit anytime. If it's like they only have certain hours, it's like that.
Absolutely, and when somebody drops in for a tour, the thing to look at is what's going on at that time of day. So for example, if it's around noontime, most likely people are going to be having their noon meal. If it's the middle of the afternoon, are the residents occupied? Is there something that looks interesting going on? Or are people just sitting around? Do people seem happy? Are the staff smiling as they walk around? How are you greeted when you walk in? These are all, I think, important criteria.
I think so, yeah. That's one of the things that impressed me when my great aunt was there. And my other aunt had been there. She started with adult daycare and made the transition quite easily. Is the kindness and the gentleness of the people who are taking care, because I think you remember my great aunt. She was not an easy person, just rather difficult, and they were just so patient and so caring that they actually thought she was just great because she was so feisty at 104 and 107. So
Well, one thing we have to remember is that we work in the home of the residents who live there, and that's true of whether it's our nursing home or our independent living or our assisted living. The staff members really are there to make it all happen for the resident. And that's the right mindset, I think, because it puts it in perspective that individuals are individual. They want to have care done in a certain way. They want to dine in a certain way. And it's important that we have that perspective.
Absolutely. Now, deciding to leave your home or having the decision made for you is difficult, really difficult. So are there any options where people can sort of try out what it's going to be like, someone or a couple that can experience the community living?
Yeah. So when it is a big decision and you don't know, is this going to work out? Am I making the right choice? So when we want people to come and talk to us and let us know what's going on, we can help them work through these decisions. There certainly may be situations where people say, I don't know if I can stay at home, but I don't know if this is right either. We don't know if we can take care of mom anymore, but we only want to try this out, and we'll work with folks. You can come in for a couple weeks. Nothing's permanent. You can always go home. Once you're there, you don't have to stay. And I know that there's some respite options available on our campus too, which is just care for a temporary basis. That's prearranged before you arrive. So we're planning on it being only for a short-term period of time. Obviously that can change if situation changes, but it's available.
Right. At our assisted living, the Saab residence, we do have some apartments that very often are open for respite use. So that means we provide all the furniture, and unlike a typical assisted living apartment where one provides their own furniture.
Right.
So we provide the furniture. It's a one-bedroom apartment. And the individual might know that they're there for 2 weeks, or maybe it's for the stay for the whole winter. Maybe it's a 3-month stay. Maybe the children are going to Florida, and so the senior wants to be safe and have opportunities for socialization, so that they will come to us for a respite stay. Very often, though, people who come for respite end up saying that they want to move in, but they don't need to. And the respite also comes in handy when we have somebody who otherwise was planning to go home after a short stay rehab, but they're not quite sure that they're ready to go home. And so sometimes they come to the assisted living also for respite stay in that event as well. But absolutely, decisions are not irrevocable. One can move in, and then one can decide, you know what, for whatever reason, this isn't working for me. At Deauville, as we know, we have many different levels of care on our campus as well. And that way, too, if somebody's needs change, we can help them navigate from one living situation to another as dictated by their needs.
Oh, that's great. So it's a smooth transition for them.
That's right.
Great. Yeah, I found that with the adult care and my aunt going in. It was a beautiful transition. She knew the people, and it was wonderful. So, what's new at DYouville now? You've got the Center of Advanced Therapy that opened in 2012, and the sub-assisted living that we spoke about in 2015. So. What other programs are on your campus, or what else would you like to say about those programs?
Yeah, so believe it or not, still a lot of things
Okay.
going on and new
I can believe
things
it.
coming. Yeah, so we actually have an application in front of the state right now to open our own outpatient rehab. So what is an outpatient rehab? Folks need rehab, and you can get rehab in a variety of settings. Obviously, we provide that on an inpatient setting. If you need to be staying with us, you can get rehab. Some people who go home and can't get out of the home get visiting rehab because it's not easy for them to get in and out. What this rehab will be for is for folks that need the rehab but don't need to be inpatient, can get out of their houses, and they can come see us on an appointment type basis. So it's a convenient offering for folks in the community. We think it's going to provide a needed service to the community, and we're really excited to be able to expand a little bit more there. A little bit earlier, we talked about having to get creative with staffing and getting folks attracted to our industry. So a program that we're really excited about is we've actually partnered with some other folks in the community at Middlesex Community College and the International Institute of Lowell, and it is a job training program where people who are interested in becoming a CNA can, free of charge, apply to this program and come and train and get the licensure. And the program offers more than just the traditional CNA training. It also offers English as second language classes, and that is a requirement. We are looking to train people that are English as second language. They have that classroom time and job coaching, career coaching on our campus. And then when they're ready to go, they go and they actually work with patients hands-on and get that experience too. They'll be ready for their state test and their state licensure at the end of this, and they can apply to become CNAs. So it's just a really, really nice thing that we're working with other folks in the community on to get people into this industry and obviously provide some workforce development for the city.
Right.
Yeah.
Now, in case some people with initials, you say, CNA, yeah, well, what does that stand for?
Yeah, so it's a great question. So a CNA is a certified nursing assistant. So it is a licensure that is given to you by the state of Massachusetts after you've completed the required coursework by an accredited institution and then passed a test that is administered or overseen by the state. So it's usually 75 hours of coursework and clinicals combined. It can take from 1 month to 3 months, depending on which program you take. Some programs might be full-time during the days, some might be after work at night, so it could take folks a little bit longer to complete that. But it usually is a charge for people to take this class in the community. What's different about the one that we're partnering on is this is free of charge. It's been funded by grant money. But the CNA is the licensure that you need to work in a nursing home or a skilled nursing facility to provide care to the people that are with us.
Okay, so you obviously have nurses there too. So
Yep.
what does a certified nursing assistant do?
Sure. So go ahead.
Oh, just want to say, Mike, by the way, is also an RN himself.
Oh,
So,
all right.
Yeah.
yeah.
So yeah, the CNAs and nurses, they work very closely together. So they're a part of the care team for the resident on a day-to-day basis. Maybe the best way to describe it is that the nurses are responsible for the medical and clinical care of a resident, giving them their medications, doing assessments to make sure that their status hasn't changed. If they have any treatments like could be diabetic care or congestive heart failure assessment, the nurses are going to be focused on that. The certified nursing assistants are going to be focused on the personal care for the residents. So their activities of daily living, like getting up and making sure that they get showered or dressed, basically the same thing you and we all do every morning. Brush our teeth, eat our breakfast, maybe walk down the hall, get us our magazine to read. So they're much more focused on the personal care aspect. But because of that role, it also puts them in a position where they kind of have the most touch with a resident, throughout the day. They're with the person the most. So it's very, very important that we have people that are passionate about this job and well trained.
Right. And really can deal with different personalities. And
Absolutely.
That's right.
That's right.
All right. What other new things are happening? Oh, no, one question occurred to me now. This training is going on, and I think I heard the graduation would be in March?
In March, right.
Okay.
Correct. So we're going to have it at our Deauville Center for Advanced Therapy on March 14th. We're inviting families and obviously some people from Deauville will be there, Middlesex Community College, some folks from the city, but we want to make it a real nice event for these people. They've worked really, really hard to get this licensure. It's not an easy course to pass. You have to be very committed, so we're excited about introducing them to the field of healthcare.
Mm-hmm. That's great.
Yeah.
That's great. So are there other new things happening, or is...
Well, healthcare is constantly evolving, Gloria.
Yeah. Mm-hmm.
So we try to stay ahead of the curve on that. Actually, our reimbursement system is going to be changing. Nothing that most people are going to be that excited about, but that will be changing later this year, and so we're actively getting ready to make sure that we're on top of that, and just always looking at the changing environment in terms of length of hospitalizations, which of course dictates when people come to us and at what course in their illness. So there's always something that we really have to be on top of. And luckily we have a great team, and we are just, as we mentioned, very mission driven. We know why we're there. We're there to provide the community with great care, regardless of whether or not somebody needs independent living or end-of-life care. Deauville is there.
Right, that's great. And I know that you have other informal kinds of events that people can attend, so even if they're not looking, just for now or for their parents or whatever it may be, what other occasions would they have to come to?
Well, the Deauville Foundation is always very actively involved in engaging the community. We have our Ladies Golf Classic coming up. Women's golf, the only ladies-only golf tournament, that is coming up in May. We have our Golf Classic coming up in June. We have our Walkathon and Carnival, that would be in September, our Lasting Impression celebration in November. But in the meantime, in the summer, we have a great summer concert series on the campus where the public is invited to the beautiful Deauville Park. It's typically on a Wednesday. And we also, during the summer, have farmers markets through Mill City Grows on the campus as well. So there's a lot. We try to invite the community in because it's important for people who live on our campus to feel that they're part of the broader community.
Yes, and it is fun to go to those kinds of things. So you don't have to wait until you have somebody who's going to be ready for nursing home or rehab or whatever to visit the campus. And it's beautiful. It's a beautiful, beautiful place, so it's worth seeing. Now, you've been there for 2 years. So
Yep.
what are your impressions of Deauville? Where did you come from to Deauville?
Sure. So I've been working in senior health care for 8 years. Well, it's coming up on 10 years now. So 8 years prior to Deauville, and I was with an organization that was very similar to Deauville in its non-for-profit status, and the lines of business that we provided to people: assisted living, skilled nursing facility, elderly housing. So coming to Deauville wasn't a big change industry-wise necessarily, but after I've been here for 2 years, I have to say, I'm just blown away with how wonderful of a place that it is. There's so much, and we wouldn't have enough time here on this show to go over all the things that I love about Deauville. But one thing that stuck out to me right away is about the community here in Lowell. I was down in Boston, so it was a little bit bigger and it was a little bit less friendly. I don't know how to actually put it. But people here in Lowell really care about Deauville. Deauville really cares about the people in here in Lowell. We care about other organizations that We just talked about the partnership that we're having. People work together. So it's just really a wonderful place. The city is just a very, very nice and warm place to be.
So I actually just had a question brought up. Payment for the services.
Sure. How does one pay?
Yes.
The payment follows the level of care that's being provided. So for example, I'll start at the most basic level, which isn't even care, it's housing. So in our independent housing, we have a contract with HUD, it's a government program, where it's a rental contract with the government. So an individual will pay according to what they're able to pay, and the government will pay the balance. In order to live at Brea Gardens, which is our HUD 202 community, one must be at least age 62 and be of very low income requirements, and those requirements change by the IRS every year. So basically, though, it's a little over $30,000 for an individual and between about $37,000, $38,000 currently for a couple. So that's private pay, but on a very low income level. When we get to the assisted living, that is private pay, but as I mentioned earlier, we have half of the apartments for people of low and moderate income. Through our capital campaign, we developed a subsidy program, so it's not integrated with any type of public funding, but we are able to offer for people of low income and moderate income the same kind of quality assisted living. And the payment follows the person, not by the apartment. So for example, there are no rooms that are set aside for people of low income. Only our business office really knows who is paying what. When we get to the nursing home, that is dictated by what the insurance will pay for. So if somebody is with us for short stay rehab, if somebody has Medicare or a managed care program, a Medicare Advantage program, the insurance will pay according to what the insurance has approved. And then otherwise, if somebody's with us long-term care, they either would be paying out of pocket if they have the funds, or Medicaid would pay if the state has approved the individual for Medicaid. And of course, somebody might have a long-term care insurance policy. So that's really determines who's paying for what. So it really does follow what the level of care is.
Fantastic. And if people want to learn more about DYouville, where can they go? Website or?
Sure. Our website is DYouville.org, or they could also call us at 978-569-1000.
And you welcome that anytime, right?
Absolutely, anytime.
All right. Well, thank you so much. This has been really, really informative, and I can't wait to go back to the campus myself just to visit. So.
Yeah, in the spring, it will all be beautiful. The park is great.
All right.
Thank you.
Thanks,
Thank you
Laura.
again,
Yep.
and thank you for tuning in to Thinking Out Loud, and I will see you next time.